Hi there, Dr. Jeremy Flagel here, coming to you from IFM's annual international conference in San Antonio. I'm here with my friend Dr. Justina Tseng, who is a functional rheumatologist in San Diego as well. So we just wanted to sit and just share with you a little bit about what we're learning. There's so much going on here. What's been meaningful? Well, maybe you want to share a little bit about what this conference is and what the focus of it is.
Sure. So this is the annual international conference for the Institute for Functional Medicine, and every year they pick a different topic. And so this year's topic was very provocative: stress, pain, and addiction, right? Was that the formal title?
Yeah.
And covering all sorts of topics related in some way to stress, which we all experience and can relate to. And then a lot of talks on specifically pain, chronic pain, various types of pain, and also touching on the epidemic that we're experiencing here in the United States with chronic opioid use and other various forms of addiction.
Absolutely, yeah. And do you find yourself? It sounds like a very simple question when it's in my mind, but maybe I'll ask you this way: how often do you find yourself dealing with stress as a primary motivator in your work as a functional rheumatologist?
You mean with patients or
patients,
my own stress?
It's another topic. But yeah, no, with patients, I think specifically, yeah.
Mm-hmm. Well, so because I see a lot of autoimmune patients and arthritic patients and connective tissue disease patients, the stress is a trigger for an autoimmune flare.
Mm-hmm.
So we're always talking about it. And specifically, I do talk about it a lot more since, with stress comes all these hormonal changes, cortisol changes, and gut issues and how it impacts the immune system. So we're always talking about stress. Sometimes because the visit we have so many other things to cover.
Sure.
We don't always get to touch upon it, but I do try to remind people to always, work on their relationship to stress. It's never going to go away,
right?
But it's how we manage the stress. So
absolutely, I think that's a really good point. Sometimes we get so busy talking about all of the other details to what we're trying to do that the conversation, setting the intention with the patient of how to try to manage that stress in a really fundamental way, it's easy to get lost, and it's easy for us to sometimes not emphasize it as fundamental.
Mm-hmm.
Yeah, it's really interesting. I find the exact same thing. People who do tend to buy into that as a fundamental path and a fundamental treatment often tend to get better a little bit faster, mm-hmm. sometimes significantly faster.
Yeah. Sometimes it's hard to do though, right?
It's very hard. It's very hard when we're very busy. Well, and I also wanted to ask you, is there anything new here that you've been excited about that you are going to take back to your practice?
Well, all of it.
Sure.
But there were a lot of really interesting topics that are presented. And, kind of more globally, the way the takeaway I'm getting is there was a lot of emphasis on connection.
Yes.
Right, and presence as, since they're talking about, how to manage, how to heal, how to transform our approach to pain and addiction. One of the key things I kept hearing from all of the talks, most of the talks, is being present with the person, whether it's a patient yes. or a family member or a friend or colleague, just extrapolating that concept of just being present with the person. And also this message of, the foundation of motivational interviewing, which is meet the person or the patient where they're at. I don't know
sure.
if you kept hearing
yes.
that, but I kept hearing that in a lot of the talks. And
yes.
I learned that during my integrative medicine fellowship years ago, the approach of motivational interviewing. And it just reinforces, what I have also found to be true is, over my career, I've changed the way I show up for the patient in the visit. or the client. And it's really not about telling them what they're doing wrong or telling them what they should be doing. Certainly I'm the consultant as a rheumatologist, I'm the specialist. So I need to share with them what I know from the research, from clinical practice, in terms of, well, what works best for this condition or disorder or labeled diagnoses. But, there's so many factors that go into where the person's at, including their stress level, their toolkit, what they're able to do to modify various things in their life, down to food and the economics of doing all this stuff.
Yes.
So what I have learned and implemented, but was reinforced to continue doing, is just really show up.
Yes.
And how do I show up? I show up in a way where it's supportive and kind, and I'm holding a space for my patient, for my client. And, rather than talking at them, talking down to them, throwing advice, it's a whole different way to practice and to be with your patient. I think there was a lot of mention about the word healing, which I love, at this conference.
Right. Not cure, but healing.
Healing, and what is healing for the patient? Right. And so, to answer your question, is reinforced belief that the way I show up and the energy that I bring into the room, when I walk in, when I sit down, eye contact, everything, body language, the words that I choose, are part of the healing experience and the treatment plan.
Right, the connection that you have with whoever you're sitting with. Absolutely.
Because that visit is part of, the process.
Yeah, well, and if I may, the connection that you're making in that moment is something that facilitates a very difficult message, which can be, we recognize that you're doing the best that you can with everything that you're dealing with, but there's another way to do it. There's this dialectic, there's this conflicting message that people are getting, and sometimes when all you hear is how you need to change, without that acceptance in the room, it can impede the change that you're actually trying to create. And I think that the connection that you're speaking of, it's if you don't feel it, I get a sense who I feel it strongly with, or usually correlates with who is going to connect and do better over time, I think.
Yeah, I don't know if you were at this last talk with Dr. Rakel.
Oh, no, I could hear the applause though from the other room.
But he was talking about intellect and intimacy.
Yeah.
And obviously there was discussion about authenticity and vulnerability, and I think that's a huge piece of the equation. That on some days I don't practice that as well as I can, and on some days I see my colleagues sometimes maybe needing to improve in that area. But we're all human, and every day is a new day, and we come back. But I liked how they really took time to focus on that. And it came up in more than one presentation.
Absolutely.
So
it's so refreshing to be at a conference where they're focusing on that rather than how many people you see in a day. How to be more efficient. The focus is on healing. It's a nice thing to do.
It seems like there's more of a trend towards whole person healing and whole person treatment, and the importance of the mental, emotional, spiritual connection piece to all of it.
Which underlies everything that we do and all the healing that can happen.
Yeah.
Thank you so much for sitting with me. It has been really fun talking to you.
Yeah, this was fun.
And sort of getting that connection as well, right? So how can people find you?
So I have a website, amoramed.com, and info@amoramed.com.
Great, and you can find me right now at jeremyflagelmd.com, or coming soon as insight-integrative-health.com. insighthealth.com as well. And you can shoot me an email at Dr. Flagel at Insight Integrative Health. Don't forget the hyphens. And anyway, thanks for watching.